We're now joined by Peter Netshipale, who's the Acting Director General for the National Department of Social Development. A very good evening to you. Thank you so much for your time. This is a project that's first being piloted in the areas of Delft, Kraaifontein and Philippi. Perhaps let's start off at grassroots level. What inspired the decision to first start and rope this project in the Western Cape and more on what you aim to achieve with it?
Thanks very much, and a good evening. We were signing the GTG agreement between South Africa and the United States of America. This program is a continuation of what the partnership between the government of South Africa and the USAID have for many years in different areas, starting from the OVC up to now the issue of the children living with HIV and AIDS. The approach that we have taken to ensure that we sign from not necessarily from Western Cape per se, but from the areas where there's more vulnerability. We look at the prevalence of HIV/AIDS. We also look at the predisposing factors or the causes of HIV and AIDS and the vulnerability that exists within community. So Western Cape has got a high level of violence against children. The prevalence of the violence in Western Cape is higher, and that's why it prompted us to start in this area.
I mean, I asked you that why the decision was the Western Cape province as opposed to what we've recently learned about the Eastern Cape government, noting that the South African Human Rights Commission's report on child malnutrition and the right to food, which calls for close monitoring and increased interventions to deal with child malnutrition because it's a serious challenge there. Was your approach research-based to first piloted in the Western Cape? I mean, you speak about the prevalence of HIV/AIDS there, but what other factors had to be considered before deciding to pilot this project first in the Western Cape?
There are certain criteria that we look at before we pilot or we choose an area where we need to pilot. If you look at in terms of the prevalence of HIV and AIDS and also the causes, and also look at what are the some of the issues that exist. One of the things that are there is the issue of, I think I've mentioned it earlier, the violence in Western Cape is higher than even the Eastern Cape. Eastern Cape has got variety of challenges that we have, the malnutrition cases, but if you look at the causes of that malnutrition in the Eastern Cape, the causes are varied, and it relates to the ruralness of Eastern Cape, where poverty is high, which leads to teenage pregnancy, which leads to lack of breastfeeding, and which then lead to issue of the vulnerability to hunger and malnutrition. Whereas in the Western Cape, what we have seen is that generally in this area, there's a lot of prevalence of violence against children. And therefore, and if you look at even general violence, if you look at the police statistics, you will realize also that there's a lot of violence here. Here we're talking about issues of rape, issues of child molestation, and looking at the issues that relates to the children that are abandoned, and that also relates to areas where the level of children that are living with HIV and AIDS becomes more in the Western Cape due to those the predisposing factors that causes HIV and AIDS infections in this area.
Yeah. With the 90 million rand being allocated for this program over a 5-year period, what approach are you planning on using to assist children in the 3 communities? How are you going to ensure that the funds are used in the correct manner and reach those in need?
The program is a comprehensive case management, which focuses on providing a comprehensive care management to children living with HIV and AIDS through early identification, early referral for testing, and also the linkages with treatment, and also disclosure. And the most important part is that the adherence. If you go to that continuum of testing, identification, testing, treatment, and adherence, there comes the issues of support and for the children and families, which involves also providing care through the caregivers and the follow-ups. You will realize that people living with HIV/AIDS has got a lot of things that need to do, a lot of tests that must take place, and a lot of care, especially the psychosocial support that you need to do to provide to children that are on treatment. So the program has got a variety of activities, but perfectly is the issue of the management of these children as cases that must be managed appropriately. One of the things is the strengthening the approach that the department need to take, training of the DSD staff to ensure that they understand what are they supposed to do, and also implementing all the packages of children living with HIV and AIDS are supposed to go through. But fundamentally, the approach is that in government we've got prescripts. There is a lot of quality assurance that is taking place, and things are done according to the book in terms of procuring the services, and also payment of the stipends, payment of the staff, and also including the treatment, support, and the capacity building that you need to provide. So there is strong supervision, and you will also realize that when you implement a donor funding program, there are very strict rules in terms of what you can do and what you cannot do. You might have seen since USAID has been in the country, there's never been any outcry in terms of misuse of budget, because they are stringent approach. They also use what you call the log frame approach, which you say you do 1 for the sake of 2, and once you do 2, you will do 3. You do, and that what you have done will be checked to whether it has been done appropriately, to ensure that whatever you do is effective and efficient.
And very quickly, we know that stats are showing that there are more and more children in distress on a daily basis, not only in the Western Cape, but across the country. How will your department ensure that it has the capacity to roll this project across the province? I understand that the next region will be Limpopo.
Yes, I think as you look at in terms of the approach of launching the program, is based on the readiness of the province to be able to deal with this, and also acceptance. There are certain criteria that you look at, whether if you roll out to a province, is it ready? Does it have capacity? There is staff that will be able to deal with that. The Department of Social Development deals with vulnerable people in the community. We deal with what the remnants of any other government departments doing is left for the Department of Social Development to deal with, through the social workers and care workers, auxiliary social workers, and also community care workers that we have within the NPOs and the communities. So therefore, our approach is tried and tested to ensure that once we start, we will be able to deal with the issues that are identified. If you look at what we are doing, we are dealing with a very sensitive issue. It's children that are living with HIV and AIDS, which means the care and support that is supposed to be provided, it must be of a good quality, and they should know. We should make sure that there is no renegation by officials or by staff, and because otherwise you'll be sending children into death immediately, because anything that happens once you are on treatment or once you identified that you are living with HIV and AIDS, you need care so that you can live and grow up into an adulthood.
Yeah.
So therefore, the department is very careful, but very competent in doing the care and support. You will realize when HIV/AIDS was identified in 1991, in the 2000, 2005, and 6, the three areas which we're focusing on was the issue of identifying HIV and AIDS, the issue of psychosocial support, the testing, pre and post. Therefore, the last one which came is the issue of the treatment, the people that are ARV. So social development straight through, from identification to testing and to treatment and support.
Very well. Thank you so much. Let's perhaps leave it there for now. And thank you for your time, Peter Netshipale, who's the Acting Director General for the National Department for Social Development. Thank you for engaging us on this topic.